Hey, so today I was on the mother baby unit. It was a good day. It was a little slow from the nursing student perspective, but very busy and a different kind of busy for the actual nurses on the unit. A lot of paperwork, a lot of charting because you don't just have one patient per room, you have two, mom and baby. So you have to chart for each one, and there's separate areas to do that. Um, so it was, and the turnover rate is really high. So you're constantly getting a new patient and prepping for discharge. So there's a lot of teaching, education, but it was fun to get to interact with the moms and the dads and the babies as well. That was always fun. Um, so my patient was, in terms of the mom, she was a 22-year-old female, G1, and then a T1001. So this was her first birth, and the date of it was a vaginal delivery. Baby was born on October 6th at 3:02 in the afternoon. So let's see, anything special about this? She basically, like most of her tests, everything, there wasn't really anything high risk about her. She did have some prior health history, fibromyalgia and Pott's disease, but other than that, it didn't affect her pregnancy, so to speak. So she wasn't considered high risk. So all of her post, you know, what am I trying to say? Like post pregnancy delivery exams were normal. So, for instance, her uterus was firm. She didn't have any bogginess. She had normal bleeding. In fact, it was very scant. There wasn't really that much bleeding. She had a first degree laceration that they stitched up, and she was doing well. She didn't really need any ice packs for that. Her main problem was just trying to get her ready for discharge. So for her personally, she was complaining of like thigh pain. So of course, when we went in there, she was complaining of leg pain, and we had to rule out very, like, without touching, kind of ruled out, any kind of cramping, clotting is what I meant to say. So looking for that Homan sign, but she actually was talking more about her thigh, not her calf. Just trying to relieve the pain. We used Motrin and really those heat packs, and that seemed to help. As far as baby, baby was 17 hours old. She had 3 cord vessels, and her APGAR at 1 minute was a 9, and then at 5 minutes it was a 9 as well. She hadn't had her PKU done yet. They were waiting. She was going to be discharged tomorrow, so they hadn't done that yet. So her general appearance and everything, baby was also really healthy. He was born early, a little bit early, and he was born with a low birth weight. I believe he was like 5.5 pounds. So with this particular baby, they were actually monitoring his blood sugars, and so that's what they were waiting on for discharge. They needed to see regular blood sugars, and the baby was having trouble latching on to mom, so wasn't really eating sufficiently. She was having a little bit of trouble nursing, so they used donor milk to supplement, and they were hoping to kind of get over that hurdle. While I was there, she called in for lactation support to kind of have a consultant come by and and help with nursing. So all of baby's vitals were good. They were normal. There was nothing that stood out about baby either. Fontanelles were soft and flat. You know, all the reflexes. It's funny, you're not like going in and like, let me test rooting. It just kind of happens. So like when the nurse was in there, she was constantly trying to get the baby to eat. So she would stick her finger in the baby's mouth, which started, you could see the rooting for the finger and then the sucking. When we walked in and we unswaddled baby, the baby startled. So the startle reflex was there. So most of them you could see without really doing a whole lot. So the main thing that we did to inspect baby was take diaper off, just make sure everything was good there. And then just kind of generally go over, she, listened to heart sounds and lung sounds for respirations. But other than that, it was just a kind of a visual look. So that was pretty much it for this patient. On top of that, I really got to see the teaching aspect for some of the patients that were being discharged home. Making sure that they know, the do's and the don'ts once they get home with baby, especially those new moms. And I also got to witness a circumcision for one of the patients, the babies. So that was interesting too. So that was pretty much it.